Okay, so picking up where we left off, when we're looking at this MRI, this is your left ventricle, your coronary sinus, your right atrium, and your right ventricular wall is there. So you see how much smaller it is than the left. Oops. So we have the right ventricle with your left ventricle and your left atrium here with your left pulmonary vein and your descending aorta. Your esophagus is right there, and here's your right inferior pulmonary vein with your right atrium. MRI, this is more T2 weighted. As you can see, it's a little bit brighter. So we have you have your right ventricle, your interventricular septum, and your left ventricle, and you can see your papillary muscles within. You have your left, oh, don't worry about that. So your left atrium and your right atrium with your interatrial septum there. So we'll start with your tricuspid valve. So your right atrium, your tricuspid valve, and then coming around to your right ventricle, left ventricle, and then this is your left atrium and your descending aorta. So right atrium, right ventricle, your coronary sinus is there. Here is your interventricular septum with your left ventricle and your descending aorta, your esophagus, it's collapsed, and your inferior vena cava. So right ventricle, interventricular septum, left ventricle, esophagus, descending aorta, inferior vena cava. You can see how low we are over on the reference image, so we know we're not at superior vena cava, we're inferior vena cava. So your heart, you're going to have to know the blood flow through your heart. So you have your superior and inferior vena cava that dump into your right atrium. Your right atrium goes down through your tricuspid valve into your right ventricle, up through your pulmonary semilunar valve, up through your right and left pulmonary arteries, comes back through the pulmonary veins with oxygenated blood, remember it's opposite, into your left atrium through your bicuspid valve, into your left atrium through your aortic semilunar, up through your aortic arch, and then the first thing off, the first branch is your brachiocephalic trunk, and then it goes to your left common carotid, to your left subclavian, and then down to your descending aorta. So your brachiocephalic trunk goes off to your right subclave and your common carotid. So looking here, it's a coronal. So we have your clavicle. This is your ascending aorta. Here's your left ventricle and your aortic semilunar valve. Here's the backside. So this is your arch here. So this is your first thing off. So this is the right side. This is your brachiocephalic trunk, left common carotid, and your left brachiocephalic. And then you can see your pulmonary arteries and your pulmonary veins down here and see how they come into the heart. So when we're looking, this is your sternum, your superior vena cava, here's your trachea, and this is your aortic arch with your left lung. So kind of the same picture. So here is your aortic arch, superior vena cava, you have your esophagus and your trachea. Aorta, descending aorta, so ascending aorta, descending aorta, and then the arch comes across. So superior vena cava and your carina. So this is right where your trachea is splitting. Ascending aorta to your left pulmonary artery, descending aorta, here is your esophagus, and your carina is here, and your superior vena cava. Looking here at the heart, we have your pulmonary trunk that comes up to your pulmonary arteries. Remember, it has the oxygenated blood. Okay, so then it gets exchanged in the lungs, comes back through your superior inferior pulmonary veins on the right and left into the left atrium. So you have your ascending aorta. Here is your pulmonary trunk with your right pulmonary artery and your left pulmonary artery. This is your left mainstem bronchus. Here's your right mainstem bronchus. Azygous vein. So that one's new. So azygous vein. So here's your esophagus, your descending aorta. Ascending aorta, this is CT angio. So here's your ascending aorta. Here's your pulmonary trunk with your right pulmonary artery and your left pulmonary artery, your left mainstem bronchus, your right mainstem bronchus. Right in the middle is your carina. Here's your descending aorta. Your superior vena cava is right there. MRI. So this is your ascending aorta, your pulmonary trunk coming off to your left pulmonary artery, and what else? Descending aorta. So I want you to know your azygos vein is right there. So CT, here's your pulmonary trunk and your right pulmonary artery with your superior vena cava. Remember, nice and bright. And here's your ascending aorta. Looking closer here, you have your pulmonary trunk with your ascending aorta. Right here is your left main coronary artery, and then it branches off into your left anterior descending and your circumflex, which is hard to see right here. So here is your left atrium and your left inferior pulmonary vein and your left inferior, wait, this would be your right inferior, this is your left, that's mismarked, sorry. And then your right superior pulmonary vein, superior vena cava, and your right atrium. Here's a sagittal MRI, here's your trachea, ascending aorta, right pulmonary artery, and your left atrium, right atrium, and this is your IVC. So interventricular septum, left ventricle, right ventricle, esophagus. Here's your descending aorta and your IVC. So the heart sits at a weird plane. So we go by short axis, vertical axis, and horizontal axis when we're scanning. So to give you an idea in MRI, when we want to go through the left ventricle atrium, we do a slice similar to this, and it gives us this, just to keep things fun. So here's your right ventricle and your pulmonary trunk. Here's your left atrium and your left ventricle. So you can see we're cutting right through it. And so we take the sagittal and we want to go through it. So we cut it here, we slice it, so we get this image. So we can see it in the long axis here. So then we want to see across short axis, and this is what it looks like. So this is your myocardium, this is your left ventricle. You can see how thick the muscle is. This is your interventricular septum with your right ventricle. So ascending aorta is here, so descending is here. Coming up off, we have your brachiocephalic trunk to your right subclave, to your right common carotid. The next one over is your left common carotid, and then you have your left subclavian. In the venous system, you have your left pulmonary artery coming down, and you have your right internal jugular with your right subclavian vein coming into your right brachiocephalic vein. So you have your left internal jugular with your left subclavian vein coming into your left brachiocephalic vein into your superior vena cava. This is what we call a candy cane. So this is your left ventricle here coming up your ascending aorta, and this is your arch right here. So this is your brachiocephalic trunk, and this is your subclavian coming over and around, and this is your internal carotid. This is your left common carotid, and this is your left subclavian. Here's a blow up of it. So your ventricle, left ventricle's down here, so it comes up your ascending aorta to your right brachiocephalic trunk, and it goes to your right subclavian, and it goes in and then out. So here's your right subclavian, here's your right common carotid, here's your left common carotid, it's the second one over, your third one over is your left subclavian, and then it comes around the arch and down your descending. So looking here, we're going to start over on the side. So this is your right brachiocephalic vein, brachiocephalic trunk, then we have your left common carotid artery, and then your left subclavian. So here's your esophagus and here's your trachea. So we're pretty close to the heart there if we're in the brachiocephalic trunk. So this patient I'm a little concerned about in the sense that their left brachiocephalic vein is really big, so it tells me there's some kind of stricture down closer to the heart. So that's the kind of stuff we look for. So here's your right brachiocephalic vein, your right brachiocephalic artery, here's your left common carotid, and your left subclavian artery. So we're also bringing in some muscles here. So you got your pectoralis major and your pectoralis minor. Here's your scapula back here. All right, so looking here at the veins and arteries, so we have the right brachiocephalic vein, right subclavian. So we're down we're higher than the heart, so we've branched. So we have the right subclavian artery, the right common carotid artery, and we have the left common carotid with the left subclavian. This is your left subclavian, so they're doing an injection on the left side. So you can see the contrast coming in. Okay, so it's being injected through the left arm, going through the left subclavian going to the superior vena cava into the right atrium. Okay, so that's how that's working. That's how you know that this right here is actually contrast going through the left subclave into the heart. So this is an MRI. This is actually an MRA. So here's your left ventricle right here. So you have your ascending, your aortic arch, and your descending aorta. So looking here, you can see that we have a right-sided injection. So this is your right subclave coming in to your superior vena cava. So if we're coming up, this is our brachiocephalic trunk. This is our right subclavian, and then this is our right common carotid. The next one over is your left common carotid, and then the next one over is your left subclavian. So looking at the heart, we're going to start looking at the vessels of the heart. So here's your right coronary, and coming around we have your circumflex, and that's the main thing. All right, MRI, this is angio, so it's a cardiac MRA. So here's your right ventricle. We're looking at the ascending aorta. You can see here the right coronary coming off, and then we have the left coronary coming off. So you have a right coronary, you have a left coronary. The left coronary bifurcates, and we have the left descending artery, and we have the circumflex. So the left coronary artery branches into the left descending and the circumflex. So looking here, we have the right coronary. You can see right there. This has been manipulated so that we lay it out in one plane. So this is your ascending aorta, this is your right coronary, and we laid it out so we can see the whole thing. This is your left circumflex coming all the way around. Pretty cool. We've laid this one out also, so this is all post-processing. This is your right coronary artery. This right here is your left coronary artery. They call that the widowmaker. If this gets blocked, it blocks the left descending and the circumflex, and you have a massive heart attack and usually drop dead. So not good. This here you can barely see. So this is CT compared to MRI. Big difference, huh? So MRI has gotten fast, so we can scan between the heartbeats, which is really nice. So here is your left coronary artery coming down to your left descending, and you can't see your circumflex. So here's your coronary sinus, where it sits in, the coronary artery sits in the coronary sinus. So, on this slide I wanted to show you that the azygos vein right next to the descending and the esophagus. So here's your descending, here's your azygos vein, and then you have your azygos vein. So looking here, this is your pulmonary trunk. We talked about your right pulmonary, your descending, so your hemiazygos and your azygos right there in your esophagus. So I'm going to stop there, and then we'll proceed on with the muscles.